my name's Andrew. I go to Manurewa High School. I'm 17 years of age. I like to learn a bit about physio because I'm interested in sports and stuff, and I'd like to know a bit about occupational therapy.
We've brought Andrew along to his local hospital where he's going to experience a couple of days exploring the work of physiotherapy and occupational therapy. First up, physiotherapy, and his mentor is Eti Talivave.
My name's Eti. I understand you like to do some physio. Yep. Cool, follow me.
Sweet as.
Eti and Andrew get straight to work. The patient is Chantal, who had an accident while pruning a tree. After a serious fall, she has a broken tibia, injured shoulder, and a head injury. Eti assesses what physiotherapy is required by a question and answer session.
And before you had this injury, were you getting around the place using any walking aids? Are you in any pain at the moment? If you were to rate the pain out of a score of 10, where would you score the pain at the moment?
Once the patient has been assessed by Eti, then he decides what equipment is necessary to carry out effective physiotherapy.
Does that feel okay on your leg there?
Time for Andrew to get some hands-on experience.
So you want to slowly raise?
The purpose of a moon boot is to support the fracture so that there's no stress when she's putting weight on it, when she's walking. Cool. So what I'm going to do is I'm going to get you to put this on the patient, and I'll guide you through it. Just slip it in there. A physiotherapist focuses on a person's physical abilities. Basically, if their physical ability is impaired, we work on correcting it. Good work.
Cool.
Nice.
The gym is an integral part of the physiotherapy area.
So this is our gym, mate.
Yeah. So please explain to me why you have like a ladder on the wall.
This ladder is usually used for what we call therabands.
Yeah.
We attach them to our ladder rung here. We use the theraband for the elbow.
Yeah.
Also for the shoulder. These noodles are usually used for shoulder injuries. They can hold it with this arm, hold the end of the noodle, and use this arm to bring the shoulder up.
Okay. So this is a really physical job, really hands-on.
It's really physically demanding. Basically, you're the one that makes sure the patient's safe, so you take a lot of their weight.
Chantal is a trainee physiotherapist.
What do you enjoy most about your job?
It's a really rewarding job. Like it's really good when patients walk out the door and are just so happy that you've kind of helped either to ease their pain straight away or just as a gradual process to help them with getting their function back, like walking or just everyday things. We get to do a lot of theory as well as placement, so a lot of practical work. I'm on placement at the moment and it's really fun getting to get some hands-on experience.
Yeah.
Physiotherapy focuses on patients' mobility, whereas occupational therapy focuses on patients' activities of daily living. Rio is an occupational therapist, and as Rio says, physios teach people how to walk again, while occupational therapists teach people how to dance.
Occupational therapists use the term occupation to define how people look after themselves, which we call self-care, work, which we call productivity, and leisure activities.
Rio puts Andrew to work. He gets Andrew to measure up Chantal for a wheelchair.
It's definitely rewarding to see somebody come in and see them not thinking that they can do much and working through with them in their journey to get back to where they were, to a stage where they feel satisfied and successful in what they're doing. Does that fit nicely for you, Chantal? Are you comfortable?
Very, thank you.
Good.
Time for Andrew to take Chantal, the patient, out for a spin in her new wheels. It's important for patients to feel comfortable with carrying out everyday chores.
So how is this going to help her when she gets home?
Chantal has her own little vegetable patch at home where she manages that daily. And so this is meaningful to her. It's getting her back into something that she would do every day, as well as giving that shoulder, like we've been doing, a good workout.
So you need to know a lot about the body and how it works every day.
Yeah, occupational therapy does involve a variety of skills, and certainly what you learn at university is your basic human anatomy and how the body works and the brain functions, and the rest of the stuff is really you pick up on the job as you go along.
But what makes a good occupational therapist?
I think someone that's willing to be a part of the team and to problem solve creatively with your clients. So if you're good at things like art, like working with your hands, that's normally a good point that you would be a good occupational therapist.
However, occupational therapy is not all about bones and muscles.
So Andrew, the type of injury that Chantel's had, falling off a ladder, has probably affected her memory. So there is a test we can do called the post-traumatic amnesia test to look at her short-term memory and her long-term memory. Now, Chantel, the area of your brain that's been affected and that controls your memory is called the temporal lobe, which is what you see in the front. And I'm going to get Andrew to do a few examples of remembering some pictures to see how you go on there. Is that okay? Good.
Cool. All right. So there we go. There's James, Sarah, Catherine, and Scotty. Can you remember those people?
That's great, Andrew. So let's go through one more time now and see if Chantel can recall the names of the people that you showed her from before.
Remember who that is?
James.
You remember who that is?
Catherine.
Catherine. You remember who that is?
Sarah.
Sarah. Do you remember who that is?
Scotty.
All right, so you got 2 out of 4, so you're missing out 2. What does that mean?
Okay. That probably means, Andrew, that Chantel does have some issues with memory retention, and it's a good pointer for us to continue doing some work around getting a memory back to possibly the way it was. So we'll work on that together.
Okay, cool.
Physical injuries can also affect taste, smell and touch. Occupational therapists have tests for all and can help affected patients accordingly. Now it's time to try some more everyday chores.
One of the fun things on the job, Andrew, is that you get to work with things like therapy putty.
Yeah.
And we're going to get Chantel to use her affected left hand as well as her good right hand to simulate cutting up a piece of meat.
Yep. So this is all fun and games, but how does this help her?
Chantel, since she's had the injury, has lost some of the condition in her shoulders, so the muscles aren't as strong as they used to be. So the action that she's doing right now is actually helping to get those muscles conditioned back to their normal function again, which she'll need to be able to do everyday tasks.
So could this be the job for Andrew?
Yeah, I think Andrew was great. He took on board everything quite well and didn't need much prompting, and he got along quite well with the patient. I think he'll be a great OT.
I think Andrew did really well. He demonstrated good people skills. He wasn't shy to give instructions, and he was not shy to be hands-on as well. So that's definitely 2 things you need if you want to become a physio. So I think he did well.
Overall, I found it quite exciting. Occupational therapy, I didn't know much about. Physio, I knew a little bit about, but by the end of the day, I knew quite a bit about it. I think physio is a job for me.
To become a physiotherapist, you need to have a degree in physiotherapy. The Bachelor of Physiotherapy takes 4 years to complete. You must be able to empathise with people's physical problems, and a good scientific knowledge is a bonus. The Bachelor of Occupational Therapy leads to registration to practice as an occupational therapist in New Zealand, and the qualification is recognised throughout the world. The entry requirements are 42 NCEA credits at level 3 or higher, and will take 3 years full-time study. You need to be a good listener, a team player, and good with people.
Supporting local content so you can see more of New Zealand on air.